Welcome to our Pediatric Dermatology tutorial entitled Rash Decisions, Concerning or Not, Climbing the Learning Curve of Pediatric Dermatology Through Image Interpretation. At the end of this tutorial, you will be able to describe skin lesions using basic morphologic terms and categorize eruptions into common morphologic groupings. Morphology is a common set of descriptive terms used to define skin lesions. This is important for communication between healthcare providers and from a medical. Primary lesions are lesions directly associated with the disease process that is described with established dermatological terminology. Below are examples of primary lesions. Macules and patches are lesions that are flat and not palpable. Less than 1 centimeter is a macule and greater than 1 centimeter is a patch. They can present with a variety of colors as the example is shown below. Papules and plaques are usually above the skin. The lesions are palpable. Less than 1 centimeter is considered a papule, and greater than 1 centimeter is considered a plaque. These also present with a variety of colors. Vesicles, pustules, and bullae. These are lesions that are palpable and fluid-filled with either blood, pus, or serum. Less than 1 centimeter is considered a vesicle, whereas greater than 1 centimeter is considered a bullae. These also present with a variety of colors. Nodules and tumors are palpable and extend deep into the skin. These are examples of the colors that they present with. Secondary lesions are lesions that are characteristically brought about by modification of the primary lesion, either by the individual, with the lesion, or through the natural evolution of the lesion in the environment. Examples include erosions, crusting, lichenification, and scales. Erosions are loss of the epidermis only, whereas an ulcer includes the loss of the epidermis and the dermis, which breaches the dermo-epidermal junction. Crusting includes an original lesion that has open skin with loss of tissue with resultant exudate that has dried on the surface. Here are examples of hemorrhagic and serous crusting. Lichenification is a thickening of the skin and accentuating of skin markings, often purple or red with hyperpigmentation, usually from chronic scratching or rubbing. It may also have associated dermatitis or excoriations. A scale is flakes of epidermal tissue that represents disrupted epidermal turnover. It may be on top of another lesion. It looks dry, flaky skin, and there are also many types of scale. Lesion arrangement and distribution. Arrangements refer to a pattern or relationship. Examples include solitary, linear, grouped, annular, or polycystic. Distribution is determined by any pattern of location on the body. Examples include acral, flexural, extensor, generalized, or mucosal. Morphologic groupings. Morphologic groupings are combinations or morphologic descriptions used to categorize dermatologic conditions. It can be difficult to clinically determine the most likely diagnosis based on lesion morphology alone, and groupings help to create a differential diagnosis. Please note that morphologic groupings most appropriate to a case is the one that best represents the original lesion, example a vesicle, and not secondary changes that develop over time. Common groups of eruptions include dermatitic, maculopapular, also known as morbilliform, papulosquamous, papulodermal, purpuric or petechial, pustular, vascular, vesiculobullous, or polymorphous. Dermatitic includes an erythema with scale, crust, or lichenification. Examples include atopic dermatitis, impetigo, with or without atopic dermatitis, contact dermatitis, and pityriasis alba. Maculopapular or morbilliform rashes are red, blanchable macules and smooth papules. Examples include drug reactions, Kawasaki's disease, measles, and nonspecific viral exanthems. Papular dermal are papules with no surface scale. These include arthropod bites, erythema migrans, erythema multiforme, milia, molluscum contagiosum, urticaria, or warts. Papulosquamous are elevated and well-demarcated lesions with scale. Examples include pityriasis rosea, psoriasis, seborrheic dermatitis, and tinea infection. Petechiae or purpura. Petechiae are pinpoint non-blanching spots that measure less than 2 millimeters in size, while purpura are a purplish discoloration of the skin that is produced by small bleeding vessels near the surface. Examples include injury-related bruising and small vessel vasculitis such as HSP. Pustular are pus-filled papules. Examples include neonatal cephalic pustulosis or folliculitis. Vascular are clusters of blood vessels presenting as a solid growth of vascular tissues. Of notes, for the purposes of this tutorial, vascular lesions have been grouped and given their own category, but vascular is not technically a morphologic grouping. Examples include hemangioma, pyogenic granuloma, and ulcerated hemangiomas. Vesiculobullous are fluid-filled papules. There are many examples of vesiculobullous lesions, and here are several examples. Polymorphous occurs when there is two or more of the previously mentioned morphologies. This occurs in scabies and pseudochilbens, such as COVID toes. We want to thank the tremendous efforts of all the people below for this tutorial. If you're interested in practicing some cases to apply the knowledge that you just learned, please visit us at ImageSim.com. Thank you.